This second week has given us time to analyze the data and the information, allow us to reflect and to draw tentative conclusions about the virus and the severity of the outbreak. The incubation period for the disease appears to be 1 to 5 days, nearly that of the seasonal flu virus. The new strain appears to be the same in confirmed cases around the world, meaning it is still the same virus strain, and it remains responsive to 2 antiviral drugs, Tamiflu and Relenza. It's still not clear what percentage of cases the disease results in serious respiratory diseases. A complete picture will not be available for some time. There are still unanswered questions, while the virus will continue to mutate and surprise. We have to nevertheless act based on incomplete information and make the relevant judgment call based on evidence available and past experience of managing such public health risks. In so doing, we must stick to good science and sound evidence, not emotion or prejudice. We certainly must not be trapped in the SARS mindset because, as I've explained before, we are fighting a different enemy and we are fighting a different war. But there are also similarities which remain applicable this time round. The Public Health Response Plan, remember during SARS I introduced this acronym PDIP, PDIP. I know Madam Megawati likes it because her party is PDIP. Protect the borders, protect attackers, Detect and isolate, so that the moment you find a case, you detect, you isolate them from further infection. And the final P is, of course, personal hygiene. The personal hygiene level must be at the highest possible level by the community. And this PDIP approach remains valid and important. PDIP saves lives and reduces casualties. In fact, this time round, the last P, personal hygiene, is even more crucial compared to SARS. So let me spend some time on this. This time round, the public play a much bigger role than hospital staff in the war against this virus. SARS was not very infectious, but deadly. If I may give an analogy, it's like a big elephant. Easier to spot, and when you spot one, you try to shoot it and kill it with an elephant gun. H1N1 is not the same. H1N1 is not so easy to detect, but it's very infectious, but so far seems to be not so deadly. If it's not elephant, it's like locust. Locust that comes once in a while, thousands of them, tens of thousands of them, sometimes even hundreds of thousands of them come in a big group. You can try to kill them with elephant gun, but it's not possible. It's a bit like when I watch my kids play computer games, the Star Wars thing. There are hundreds of thousands of those attackers, and you try to shoot them down. Young kids are very agile, but even then, there's a limit to how many you can kill. You get very tired doing so. So that cannot be the way to attack this enemy. We need to deal with different threats differently. With H1N1, the government is separating anyone from Mexico, and we will watch where else the virus spreads to, and then introduce containment measures appropriately. But at some point, when the virus is in too many places, and we will not be able to block it further, we ourselves will get infected. And that's why I've been warning about cases appearing here and causing local clusters. It's a matter of time that such a scenario will happen here. We have bought ourselves some time with strong border controls and home quarantine order. Meanwhile, let's get ready at a community level. How? Up our standard of personal hygiene. Let's benchmark ourselves against the Japanese. The Japanese are world famous for being clean and a very high standard of personal hygiene. Singaporeans are not. We are not there yet, but we can be like the Japanese. We ought to be like the Japanese. We are in a first world modern city, well educated, well informed. Let us be like the Japanese. We are not there yet, but let's use this crisis to up our standard. Let us try to encourage one another. If you see one who coughs in the wrong way, try to nicely ask him to cover his mouth or her mouth. Minimum stare at him. Apply some pressure, but please don't fight.